So I get very luckily I get involved in some sort of biotech company's invitation as a medical advisor in some. I also happen to work for another company. It's a new startup as a CEO. So there's a lot of work from them, and also in other biotech companies. So there are quite a lot of new innovative biotech ideas which needs to be executed. So that is actually quite challenging and interesting. So my social contributions, I also have been in the Medical Association for 10 years as a council member. I also in the Medical Council. I also was the chairman of the Hong Kong Ophthalmological Society, which is a bigger society for eye doctors. And I also work in the, during my time in the Medical Association, I was involved with some community projects. We did some projects with the community, like in Kwai in Taiwan. So we are doing a e-Security Hub. That means that try to merge the medical sector within the community and also the NGOs. So there's an interplay with the NGO, with the community doctors, and with the volunteers. So we are trying to integrate some medical knowledge or very medical useful daily knowledge into the community through those volunteers. And we are setting up a like a social university to teach those volunteers so that they can teach other people in the community on different health topics. So we are also doing that in the last few years. So I think that has actually got a lot of funding from the government, and also we are, the plan will be to extend into other districts as well. So those are the interesting projects that I get involved in. So now talking about the COVID is a very scary thing. We know all that, this last half a year we stay home while the doctors work for you in hospital. And we're trying to control that pandemic. But by the looks of it, in Hong Kong, in the last 1 or 2 weeks, you can see that there's a surge of cases with unknown origin, with unknown source, and difficult to trace the contact history. So that is actually getting a little bit out of control. I hope that from a lot of professional advisors now, with the stepping up of the measures from the government, I hope that the pandemic can be, coming down into a control phase. But it's hard to know, it's hard to say. So we still need to wait to see if this pandemic is going uncontrolled. If it's uncontrolled in Hong Kong, it's going to be very scary, because Hong Kong is a very crowded city. People tend to stay together at home, and the social interaction is quite a lot compared to some other overseas countries. And the most important thing is Hong Kong is very small, and so it's very easy to transmit with this COVID. So I think it's very all Hong Kong citizens should really stay home, okay, and try to minimize the contact with other people. So I think Zoom meeting is perfect for this. Now we can see that the third wave is growing up quite dramatically over the last 2 weeks, and now is going past the 2,000 mark for new cases. For new cases, and the third wave is still not reaching the top of it, and some people say that this, in the beginning of the year, some people say that, this COVID can only just last for a few months, and by summer it's going to be getting better. But all the evidence has shown that the COVID is going to stay. It's going to, it can mutate. So in usual terms, when a COVID virus mutate, they gained more transmissibility. But however, they should be less hazardous to people. So that means that they are more transmittable but they may not be as damaging. So they may not hurt more people. Okay, so the risk of more fatal complications will be less. But of course, it's hard to say because it's a new virus. We still don't know. We still don't have enough evidence to see if the coronavirus is going to be getting worse, or getting in terms of the virulence is getting worse or not. So, but of course, over the last few months, Hong Kong people, in the beginning, we did a very good job, and we successfully helped to control. And there are 2 months that we are relatively safe with very minimal local cases. But of course, a lot of Hong Kong people getting fatigued, getting tired on the pandemic, and they are less alarmed in terms of social interaction. So that is, I'm sure that this is going to be a long haul for most of us in the world. Now, social distancing is very important, I think, because even if there are a lot of measures to control this, to help to curb the virus, but I think social distancing is by far the most important, keeping it more than 1.5 meters. But having said that, the virus don't transmit by droplets alone. Okay, we know that there are evidence that the virus can actually transmit via in a very contained area. It can transmit it in limited fashion via air. Okay, and also by touching, you can contaminate the different parts of your, or in your home, or in your ward, or in an office. So the contamination itself, the virus can stay on surfaces for hours or even days in some papers. So by touching it and touching your mouth and nose, you can contract the disease. So that's why some other people have done studies. They look into different environment in office settings, in a ward settings, and then they will know that a lot of, say in a ward, the most contaminated area may not be the table or the desk or the telephone, but maybe the door, the door handle, maybe the window, the edge of the window. All these areas that are less, they're neglected, they may not be cleaned. That is actually more easy to transmit the virus. So that's why touching anything, you have to think twice before touching your own orifice, own mouth and nose. Also in an office, the keyboard on the desk, the edge of the desk, the edge of the shelf, all these, or even the papers, and also maybe in a clinic, maybe a patient chart. All these areas is very easy to have the virus staying there for days. And if you touch that chart, you need to clean your hands. So I think cleaning hands, avoid touching nose and mouth is very important. Now, talking about the PCR testing, this is actually a very interesting test. In SARS period, we struggling a lot with the PCR, and it takes days for the results to come out. But now in the COVID, everybody can read from the news that the PCR, it only takes a few hours for the results to come out. The problem for some of the test centers, why it takes up to 1 or 2 days, is because of the collection, and also from the preparation of the specimen. Because for PCR stands for polymerase chain reaction. That means that you have to, for each sample, you have to amplify the segment of the DNA. Let it be RNA or DNA, you need to amplify it, and amplify enough so that it can stand out as a test positive or test negative. But of course, preparation takes time, and also the running of the test and the logistics of the test takes time. So that's why the test itself doesn't take long, but the preparation of it does. So that's why it takes usually 1 or 2 days, sometimes overnight. But now we also had some antibody tests. Antibody test is a different test. It's different from the PCR. It's not looking at the genes. It's only looking at the antibodies, like IgM or IgG, which are the two usual antibodies that happens after you had an infection. So that only tells you whether you had an infection in the past. And also, if you had an infection in the past, those immunoglobulins, those antibodies may wean off after a few months or weeks. So that's why by doing a spot antibody test is not very useful. So the golden standard test is still PCR testing. Now, probably everybody has known from the news that Hong Kong in the last few months, we have been doing very poorly in terms of PCR testing per day. We are stepping up now because of the surge, but still every day we are only doing around 7,000, 8,000, and the lab is including the private hospital, including the private labs, is already towards its threshold. So those labs are all in full capacity. So what happens is if we're going to step up and do a full testing or whole population testing, that's going to be difficult, because talking about 7 million people in Hong Kong, if we are going to do for all working population, that is 3.5 million. And if you only do 7,000 per day, then you need a few months, if not half a year to finish all the tests, and which is going to be a very long time. So there must be, if the surge is going to be out of control, there must be new ways of conducting this test. I'm helping another company to talk about the sampling pooling, but that is actually out of the theme of the topic today. But that's actually very interesting ways of getting around the test numbers limitation. But of course, that is, you probably can learn more about from the news later on. So now the contact tracing is very tedious procedure. So when we watch the press con from the CHP every day at 4:30 p.m. and when there are more than 100 cases per day in Hong Kong, the contact tracing is going to be a hard job, because most of these cases, they go different places over the last 2 weeks. They have come into contact with different people. They can be thousands, if not hundreds or thousands of people. And defining close contact versus usual contact versus no contact is arbitrary. It's comparative, relative. Okay, so there's no guidelines on why we define somebody as close contact, why we define. So all these definitions are arbitrary or relative. So contact tracing, for most of you non-medical audience, is something that is important to do, but it's very difficult to do. You won't be able to do 100%, almost impossible. Why? Because if you think about what you do in the last week, how many people you have talked to, you might be able to work it out. But how many people you have brushed shoulders across, or you have encountered briefly, or you have just face-to-face for 10 seconds, that is difficult to count, okay, for everybody. And some people, they might be seeing a lot of clients a day. They might be, and also all these identity are difficult to trace. So that's why if we believe if you don't have close contact, your risk is small. They can only give you a certain possibility. They won't be able to tell you that, oh, this is non-contact, this is not possible to transmit the disease. They can't tell you that. They only tell you the possibility is low, okay, if you had a very usual contact. They define as a close contact for patients if it's a face-to-face contact. If it's a close contact, if it's more than 15 minutes. So that means that if you wear a mask, both of you wear masks, and then you talk face-to-face for 15 minutes or more, then that's a close contact. So how do they define 15 minutes? Why 15 minutes? Why not 10 minutes? It's all arbitrary. So that's why I just want to show you just one point in the contact tracing, that how difficult to trace for patients. So that's why there's always a chance that somebody is gone missing, so you cannot trace, and then it can bring the transparent transmittable cases in the community. So this is the difficult part. But of course, so most patients, if they are staying in one or two places most of the time, if they don't go away, don't go out a lot, if they don't work, if they don't their mobility is not high, then it's easier to trace. So that's why I think the social distancing is by far the most important. If you don't do social distancing, it's almost impossible to trace everybody. If you do social distancing, if everybody stay home, if everybody stay work from home, then the chance that you can trace the contact is easier. So that's the concept. Of course, now there are a lot of new inventions, innovations that can help you to trace the contacts. Of course, it's not by no means that is accurate, but by GPRS, might be able to detect, or sometimes you can even there are also apps that you can use, you can download to check if there's any detect your social distancing is doing fine or not. I'll quote a little bit, a few examples later on this, but I'll just tell you that there are also the electronic devices, digital platform can help with the contact tracing. So the efficiency of the control really is a competition of time, because if you don't do that, the incubation period, some people can be as short as 2 days, 1 or 2 days. Some people can be 14, 21 days. So it's very variable. Some of it depends on how close the contact you keep with the infected case. It might be related to the dose of the virus that you get infected. It might be the strain that is infected. But of course, it is all the variation that affects. But the common point is the time, because if you don't trace the contacts, if you don't curb or you don't stop the transmission in time, then the spread will be very, very quick. Now, some jargons, if you like, talking about in terms of WHO jargons, in terms of the COVID management, we can talk about the containment. Containment meaning that you can contain the epidemic or the pandemic and trying to make sure that it won't spread out of the black box, if you like. So for containment, it's actually what we are doing in the first phase in Hong Kong pandemic control. Because in the beginning, in March, in April, we would be able to trace even, almost of the contacts. We have a 群組, we have a group of people that get infected. We can trace all of them, and we can contain them. So in the community, until the end of June or beginning of July, when you walk on the streets, you feel safe because the virus in the community is not a lot. Okay, is low. It's very low. So we are probably in the phase of containment. Now we are in the more towards the control and mitigation. Mitigation is more like a 走散, is already coming out of control a little bit and trying to mitigate, lower the impact, to reduce the incidence, reduce the mobility or the mortality. So something like in UK in the beginning, you have heard about the herd immunity concept, which means that if you had a disease, if you suspect yourself, you catch the virus, but if you are not sick, you don't go to hospital, you stay at home. That is a mitigation. This is not a containment, because that is not how it contains the virus. It's how to stop or minimize the transmission to the community. But knowing that that patient with confirmed or suspected case, they are in the community already. So presumably they can still transmit to other people. Only those with very sick, short of breath, they need to go to the hospital. So if we are towards that phase, then we won't send all patients either suspected or confirmed into hospital anymore. We will ask them to stay at home. Only those with a very severe symptoms, or they are hard to breathe or have complications, they come to hospital. That is one way of mitigating the pandemic, but the pandemic will be out of control by then. So we are still in the containment phase. We're trying to contain, but all the evidence saying that because of the contagion, the very contagious nature of this COVID, is getting more and more difficult for the containment phase. And of course, for every pandemic, there is a curve, there's a course. We can see that if we have done measures in terms of social distancing, in terms of containment, we can kind of flatten the curve, but inevitably it will lengthen the whole pandemic. So we are towards that phase. So we are in a you can see that we are in the green curve. So we are lengthening our measures, the time for a few months already, for half a year. We might be doing that for another half a year or even 1 year. But then the good thing about flattening the curve is that we would not send too many patients into hospital, and will not overwhelm the medical sector or overwhelm the medical healthcare services. So that is good, because that means that we would be able to not, making the medical or the health workers working day and night, or even, we need to, open those temporary wards to cater for these cases. But the battle that we are facing will be much longer. Okay, so that is how we trying to modulate the curve, if you like, so that we are trying to fit the current health resources into our own city pattern, okay, the disease pattern. So that's why I think it's important that for every city there is their own strategy. Most of the cities now which went out of control, they have a very sharp peak, very high peak, and then there may be a faster, elimination period. But of course, even though if you look at the USA, it's already 3 or 4 months now, and it's still not controlling. So that's why the problem is the blue area. If you look at the blue one, because if you're lifting some measures, inevitably there will be a lift, there will be a surge, a second surge, a third wave, a fourth wave. So that's why that's the reason why we need to be very important for public health professionals. They need to look very carefully on how to use their social distancing measures to control the pandemic. That's very important. Up to now, any questions so far? Am I too fast, too slow? Everybody's okay?
Yeah.
Okay. Everybody's
yes.
Already. That's okay.
Very valuable information too, Jeffrey. Thank you.
Yeah, very insightful.
Okay, thank you. So now we talk to Clive specialty, okay, which I know very little about. Now, I do a lot of social charity work, but I am not, in this sector. So that's why I need to pick up the brains from all of you, and also from Clive, in this area. But when I look into social innovation, we are very important that we are looking into these areas. So the 5 characteristics of the civil social innovation, okay, which include the novelty. We need to. There are a lot of process going on in the society. How are we going to innovate or being innovative in terms of re-engineering of new ways of re-engineering the social process? We need to be novel. We need to be new, effective, but it's practical. Some people they think about something that is very useful, effective, but that's not practical. It's difficult to conduct. And most importantly, you need to meet social needs, because this is social innovation. You have to be useful, and also have to meet the needs in the society. And different society, they have different needs. So that's why this comes into a more unique in different parts of the world. The social innovation ideas have to be remodeled, have to be amended in a way to suit the local needs. I think that is very important as well. And of course, the empowering is important. So we have to enhance the society capacity to act collectively, because that's at the end of the day, there's a small group of people doing something, but if other people don't share the same values as you, or you're not affecting enough people to share the same value, the project become useless, become less effective. So I think that is also very important.
It's very insightful slide.
Yeah. So now, in terms of issues, I just trying to highlight some issues in during this pandemic, so everybody can give you their own ideas. In terms of issues in COVID, is that first of all, social issues. Okay, people feeling isolated, they feel lonely, they lack of social physical interaction. They even sometimes have heard from a lot of psychiatrists telling me that the patients, they are afraid of coming out to see a doctor. They have problems in continuing their medications. They have difficulty in monitoring their symptoms because the doctors find it difficult. They cannot see the patients. So the mental problems is going to be an issue. They stay at home. They may not, they read a lot of news, but they don't know how to ventilate. So sometimes that can lead to mental problems. And the health awareness overall for most people are getting much higher. Okay, people now wearing masks. They have sanitizers at home, alcohol swabs. What you can think of for the health, for the hygiene. They're more aware about the hygiene environment and health environment. Secondly, economical. Everybody, because there's no economic activity or very minimal economic activity, a lot of business suffer. F&B business, retail business suffer a lot. There is a term that is the economy can become paralyzed because of this. And for Hong Kong, because we are in the flattening curve phase, we are facing actually a much longer time in order to for the economy to come back on schedule. So in terms of that, we might need a longer period to recover. So are we prepared for that? How are we going to deal with that? So those are the things that we need to look into. For personal, I think people are worried about whether they contract this disease, okay? Whether they get COVID or not, how confirmed they should, how should they seek for help? How will they suspect if they once got COVID-19 or not? And once you got COVID-19, how to treat? And what's the information on this? In the web, there are a lot of information, but most of them may not be very, different. The information is very highly variable, and it's very difficult for people or normal people to know, in a nutshell, the correct management. And also for this disease, it's a new disease, is very variable in different countries for the management. So all these also give a lot of insecurity for most people. For medical part, from the medical sector, we talk a lot about treatment modalities. There's one set we talk about the hydroxychloroquine. You remember that medicine, treatment for malaria, which is thought to be useful. The USA, Donald Trump said that, oh, it's very useful. We have a lot hydroxychloroquine and we can cure the disease. Eventually it turns out to be only minimal to moderate effectiveness. And Brazil has used a lot of hydroxychloroquine, but now we know that there is a cocktail of treatments for antivirals that might help. For most patients, supportive treatments is all they need. They don't need any more than the supportive treatment. So oxygen monitoring is enough, because most of these patients who contract the disease are very mild. Hong Kong is very lucky that, because when we look into the Hong Kong statistics, most patients in Hong Kong, they are pretty mild. The fact that compared to the mortality and the morbidity rate, Hong Kong is doing much better than, say, the US or even in Europe, Italy and Spain in the beginning. For vaccines coming up, we've read from the news that on the same issue of Lancet just last week, I think there are 2 papers, one from the overseas, from UK, I think they're from the team UK that has and looked into the vaccines, and another paper from China. So people are talking about whether vaccines will be on the way. So there's a competition, the effectiveness, efficiency of the vaccines, how to conduct, who to give. These are all very realistic questions, so we need to face. And of course, you have read about respirator issues in the US, fighting for it in Italy, or the other equipment, hygiene products. So those kind of things have also there are a lot of opportunities. Remember in Hong Kong, we talk about the mask. Clive just mentioned about there's Hong Kong, we have different vendors or merchants setting up factories for masks, local production, which is very good. But of course, we are all well prepared because we know this COVID from the beginning of the year, so we are more prepared than the overseas countries. But of course, the mask is one issue, but also the other equipment, respirator, hygienic products. So all these products, they have created a very, very huge market in the medical sector. From the national point of view, I think it's from the government, public policy, public health policies, talking about disease containment, mitigation control. We have talked about that before. And in terms of global, we are facing a lot of the independence among different countries. They don't want to anti-globalization. They want to make deals with other countries anymore. They want to close their borders. And also, we are in the midst of the Sino-US trade wars, or maybe there's a increasing tension between the 2 countries. So we are facing a very, very critical period in Hong Kong, in the middle. So all these background and issues are something that we can think about, and how we can find out opportunities from it. So Google and Apple, they have launched contact tracing software. I think that's actually very thinkable, something that's thinkable direction, okay, for contact tracing. Contact tracing, I think, is important to do. Not very useful in a very crowded city, if you like, because for GPRS, that might be difficult to detect in very, very, very detailed places. But in overseas countries where people they move around, if you can trace their the contact points, you will be able to highlight, and you plug all that data into a big data or analysis software. You will be able to actually figure out where is the outbreak of the pandemic, or where is like in Hong Kong, when we look at Tseung Wan Shan, we look at those areas. They're the high risk area. Sha Tin, there's a high risk area. Why? Because there are a lot of cases that has stayed there, worked there, and you move around in that area. And then by doing all this contact tracing analysis, you will be able to highlight the outbreaks areas more accurately. But of course, people are mobile, so this is not going to be a one-off analysis. It's going to be a timely analysis. So that if that can be shared for the public, which can give a lot of information for people, and then that would be able to for people to avoid going to somewhere that is actually high risk. So I think that is actually something that is important for the public health professionals. It's also important because you can trace the contacts easier. You can highlight those high risk areas, and then you can do the decontamination. You can do the sanitizations immediately. So all these are very important. Talking about a little bit about Taiwan. Taiwan is also doing very well. We know that the Taiwan statistics is doing extremely well, even better than I think the China. Maybe Macau is slightly better than Taiwan, but Taiwan is a big city, big area. So I think for the Taiwan, of course, there are a lot of good ways that we can learn from them. Border control is doing very well, but their use of the social media with the transparency, they allow people to report to the government immediately on what happened in the web or what happened in their own opinions can be reflected very timely. There's a collective intelligence system that is they're using. So every citizens can write to their government on in a social media and then let them know what happened. They can also, from the medical insurance card, they can check in different spots whether there's enough mask stock level in different shops or pharmacy. So people won't be panicky about running out of masks. They are more in control. People are more in control. They get more information. There's also a social media campaign, Ask Taiwan Anything, and then where you can share and you can communicate with other people, with the government. So they are trying to increase the public engagement. So people in a more transparent environment, they would be able to know more. And so that's how they are trying to put into the digital innovations into the public health sector. In Hong Kong, we are lagging behind. You very seldom have seen a collaboration between the Food and Health Bureau people coming up with the Changfang, the Innovation Commission, on how to improve the infection control. All you have in Hong Kong is the dashboard that we can log into. There's a website that we can log into, but of course that is actually the basic stuff that we have. So I think there are ways that we can further improve in Hong Kong in terms of the infection control in this area. Some overseas, there's a lot of people doing meaningful things. They have looked into chatbots, virtual assistants. So for the vulnerable population, like in the elderly or even in the children population, they cannot go to school. They're lonely. They stay at home. They are lack of help. They even have difficulty in cooking meals for themselves. They have psychological issues. All these people, they can be connected with chatbots, but of course it depends on whether we can link up. In Hong Kong, we can link up Ping An Zhong, whether we can do a little bit more work from that. We can try to utilizing the established network in order to encourage more communication between those elderly at home. That's something that we can consider doing more. So I think all these is important concepts. There are companies which look into how to because people are afraid of touching the elevated buttons, panels. So there are systems that now how to you can fit into like a touchless lift panel that you can touch, just pack onto the usual lift panel that you can help you by doing a touchless technique that you can you can press a button. So that's also something that is innovative. Okay, but whether that is going to be a long-term demand, hard to say. Okay, so that some of these are innovative ideas. I think it's for the audience to judge whether it can fulfill the 5 criteria that I mentioned. There's also new innovative ideas to replace masks. So there is a company that is trying to to develop an aerosol squirter. So it's like a squirting out the aerosols in front of the face as a air mask, if you like. So you don't need to wear a mask. And that's actually quite good for most people, because some people think that wearing masks is a very uncomfortable thing to do, especially in a very hot climate. So if there is something that can replace a mask by squirting those aerosols in front of you and can drive all these viruses away, it might be a good idea. But whether that's usable, cheap, and reproducible in everywhere in the world is an issue. So those things are good and innovative, okay? But whether that's we can be reproducible in large quantities is difficult to say. And also a lot of apps. You can see that there's a lot of apps doing reminding you of like in the pubs, in the restaurant, if it's reopened again, whether you are doing enough social distancing. But that's a little bit, in my opinion, I think it's not very practical, because if we are closing all the bars and the restaurant already, I think that is actually a little bit too much, or a little bit overlapped and not very useful. But all these are thought of by innovative people all over the world. So those are some of the examples that I just trying to mention to to let you all think about it. There's a LACNACE that can help to use the infrared sensors, to remind the wearers of the social distancing. So they will remind the user if they have somebody approaching them in a 360 degree, they will alarm the wearer. So this is again very innovative, but of course whether it's useful, practical is another story. I think there's another one. That's a heat map watch. So a watch that can fit into a heat map that can tell you whether in outdoors, when you run outdoors and doing exercise outdoors, whether you would try to avoid crowded places. Because if there is an increase in hot spots, then that means that there's a lot of people there, and then you should avoid. Those are the innovative, also very innovative. Okay, so in Hong Kong, we do a lot of e-commerce. So I think those all that Hong Kong TV Mall, they have boost a lot in terms of their business and so on. Okay, and I know that Foodpanda, Deliveroo, they are trying to not just doing the food delivery, they are trying to do a digital shopping as well. You can deliver whatever products that you can buy online. So now they are doing a lot of delivery. Not limited to food, but also to other categories of goods. So it's the e-commerce is booming a lot. For the clinical side, I think it's important that we talk more about telemedicine and drug delivery, because people, they stay at home, they don't go out to clinics, so they have difficulty in getting medicine, getting their prescription. So now we just last week we also for our group, we are doing telemedicine consultations for patients who want to do COVID-19 testing. So we do a telemedicine approach for patients. We ask those questions, and then we refer these patients to do the COVID-19 testings by delivering the box, the bottle for them to collect. So these are the ways that we can bypass the current ways of doing a physical consultation, but by doing a telemedicine consultation. So all these in HA, there is already doing it. HA, because they're closing a lot of elective surgeries and a lot of outpatient services. So people, if they want to have prescription of their medicine renewed, they can do it under telemedicine, and then they can be renewed with the prescription. And the medicine can also be, in some NGOs, they can be delivered also. So, you can save the patients coming out of the homes to pick up the medicines. So all these are good areas that we can think of. So I think this is the final slide anyway. So I hope I don't bore you guys with too long. Those areas, I think, is very important. So it's a very important messages. So whether we can think about something innovative, practical, and and be able to empower other people to use it. I think that is some areas that we can look into. Okay, so in terms of contact tracing, in terms of the disease prevention, digital marketing, and for the government, we need a more teamwork from different bureaus to help. And just a few points from below, there's a lot of fundings available. Of course, by applying for the funding, it might take a few months, and by the time it may not be we may not be grabbing the right opportunity because the COVID is changing so fast. So it's yet to see how the COVID is evolving and the society is evolving in the face of that. So thanks for listening to the talk, and I'm welcome for any questions. Thank you.
Thank you, Jeffrey. It's so insightful, and thanks for all the social innovations that you shared, and also you also gave us our team members lots of tips. Which areas they can focus to. Yeah. So, is there any questions from the floor?
I do have a question.
Yeah.
Like the measure we can take in. I wonder, is there any measures we can take in to better lower the possibility of getting infected by the virus, apart from the basic, like wear a mask and wash our hands, if we really don't have choice but to go out? Because at the earlier stage, when I have to go out, I always feel so anxious because it feels like a mask and sanitizers are still not enough.
Yes. Now, we talk about those sanitizers we use. Most of them you buy in the market. They are not up to 75% actually. So most of that sanitizers, when you put alcohol on your hands and wipe it, first of all, how long if you use those alcohol for? People are saying that you have to use it for 20 minutes, 20 minutes to wipe, and then you have to use 70 to 75%. Some of the alcohol you buy in the market sometimes are only 60%. So you have to read very carefully. The quality is different. Of course, if water is available, soap is available, you wash your hands for 20 minutes. Wash everything thoroughly. That's the most important. Touching surfaces, including how your clothes is touching when you're sitting on a chair, you can get contaminated on your clothes. And then if you touch your clothes and you touch your face, is a transmissible.
Oh no.
So there are a lot of ways. If you think about very carefully, that is almost impossible that you can prevent every trace of transmission, but you try to limit everything. So I think social distancing is important. Now, I've just heard from this morning that there are 2 cases in Hong Kong U, in the hall of Hong Kong U that have suspected case or confirmed cases. So there will be news coming out to say whether there's any measures that is going to be in the hall, because but now for summer vacation, I think most people are moved out of the hall, so it's okay. But I think for those that are still staying in the hostel, it's important because those are not very clean, as if you know. So that can also be a source that if you share, towels, share bathroom, share toilets, those are high risk areas as well. So I think if you are afraid of anything, you stay at home. If you have to go out, you have to be very careful. Public places, public transports, the taxis, sitting in taxi driver is a possible route of transmission. So if I'm you, I probably won't take taxi. I'll probably just go for MTR. So there are a lot of things that you might have to think very carefully. Before you might just think that it's nothing major, but now you have to think very carefully on what every step you should do. So, but of course, all these things will take into account, because even if you take, if you touch one spot that is transmissible, and you can still get infected. So that's why just to be careful in every small steps. That's all I can tell you.
Thank you.
Okay.
Any more questions?
Hi, Jeffrey. Thank you so much. This is Philip, and this is a great session. I'm thinking that I see people over these past months, probably many are getting tired of this kind of anti-pandemic measures, and then they start taking off their masks. They put it under their chin, etc. So I'm wondering, if people know this knowledge you're sharing with us, the situation might improve a lot, because they don't know what it means. You keep the social distancing, how important it is to control it. Yeah. So this is what I'm wondering, and I look forward to seeing that this information could be brought to as many as possible, and to make people aware of these matters, how important it is.
Yes, thank you for your comment, because I think I from the medical sector, we are trying our best to let people know. So we have different channels. I myself have talked in different areas. I write in a newspaper myself every week. But of course, you know, there are so many medias, and people now tend to look into Facebook. So, you know, even Facebook sometimes I write, but it's difficult. But I think if you really want very trustworthy information, go to the government website, you know, the CHP, the Center of Health Prevention, and Health Promotion website, and also the DH website. They should have the good information. But of course, the point that you mentioned, not wearing masks in the public places, smoking, you know, and in groups, this is proven to be a high risk thing to do in the public. You remember last time there are suspicion on last year. There is a number of cases in US with vaping, which means that they are using electronic cigarettes, and they are reported of a number of cases which has got a very severe lung infection and respiratory symptoms. In the beginning, we don't know whether it's related to COVID, but there are some evidence saying that that might be the first wave of COVID. So we don't know either cigarette smokers are in a high risk, or electronic cigarette smokers are in a high risk of catching these viruses, because these patients, the smokers, they usually have a weaker lung. They have, we know a lot from the research papers that people who are chronic smokers, their lung, the bronchus, the airways, the inner lining of the airways is not functioning as effective as normal people who do not smoke. So that's why there are a lot of people are trying to link up that vaping incidents in US last year with the COVID, or the possibility of a COVID infection. But of course, that's not concrete evidence now to prove this relation. But of course, I think for most people, in the community, we need to be aware. Any measures that you talk or get in close contact with other people, remember, wear your mask. If you wear a mask, the chance of catching the virus is much less. But if you wear your mask, but the other people don't wear a mask, the risk is already double up a lot. So you have to make sure the face-to-face contact with the other party have to wear a mask. So that's important.
Thanks, Jeffrey.